Hello, and welcome to another video from Dr. Ties. Today, I am going to talk about vomiting and morning sickness in pregnancy. I will explain what this means, the possible causes and risk factors, and how it can be managed. Please don't forget to share our videos so that we can reach more people. Nausea and vomiting are very common symptoms in early stages of pregnancy, and this is also called morning sickness. Nausea or vomiting can happen at any time of the day or night and not just in the morning. Although morning sickness usually settles down by 16 to 20 weeks of gestation, it could take longer in some women. It does not harm or put the baby at any increased risk. It is thought that hormonal changes in early stages of pregnancy lead to morning sickness. There are also risk factors for developing morning sickness, and these include first pregnancy, having twins or more, similar symptoms in previous pregnancy, history of motion sickness or migraine, positive family history, and being obese. There is currently no cure for morning sickness in pregnancy, but nausea and vomiting can be controlled with certain lifestyle changes and medications. For mild morning sickness, it is recommended to get plenty of rest as tiredness can make nausea worse, to avoid foods and smells that cause nausea, to eat plain food like dry toast or biscuit in the morning, to eat small and frequent meals, to eat cold foods rather than hot ones, and to drink plenty of fluids. It is thought that ginger may help reduce nausea and vomiting, so foods and drinks containing ginger may be beneficial. If lifestyle changes do not work, there are medicines that can be used in pregnancy, including the first 12 weeks of gestation, to help improve morning sickness. These include anti-sickness or anti-emetic medications, steroids, or a combination of both. If one anti-sickness medication does not work, an alternative medication can be tried until the most suitable one is found. In some women, nausea and vomiting can be very severe and significantly affect their daily life. This severe form of pregnancy sickness is known as Hyperemesis gravidarum or HG. This is a serious medical condition and often requires hospital treatment due to risk of dehydration and malnutrition resulting from constant vomiting. The exact cause of Hyperemesis gravidarum is not fully known, and it is thought to be related to hormonal changes in pregnancy. Having positive family history or presentation in previous pregnancy are risk factors for developing it. The main symptoms of Hyperemesis gravidarum are severe, prolonged nausea and vomiting, dehydration, malnutrition and weight loss. Unlike common form of morning sickness in pregnancy, Hyperemesis gravidarum can continue throughout the pregnancy until the baby is born. However, the symptoms may get better at around 20 weeks of gestation. Hyperemesis gravidarum can be treated with anti-sickness tablets, injections or suppository that is inserted into the bottom. Severe cases may require hospital admission to have intravenous or IV fluids and anti-sickness medications. Having hyperemesis gravidarum in a pregnancy can increase the risk of it happening again in future pregnancies. It should be noted that sometimes urinary tract infections or UTIs, including kidney infection, can cause nausea and vomiting in pregnancy. It is advisable to see a doctor in person if there is severe nausea or vomiting, very dark-colored urine or no urination in more than 8 hours, pain or burning on urination, weakness, dizziness or fainting feeling, abdominal or back pain, high temperature, weight loss, or blood in the vomit. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment in any way. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Images and animations in this video are only for illustrative purposes.